please welcome to the stage, Caroline Roan.
That's forward. Good afternoon, everybody. My name is Caroline, and I oversee global health at Pfizer and serve as president of the Pfizer Foundation. Thanks for being here this afternoon. Today, I'm going to talk to you about innovation, but innovation with a twist. And to set the stage for our conversation, it's important that you know that at Pfizer, we believe every single individual deserves access to quality healthcare, medicines, and vaccines. And of course, innovation is our life's work. We need innovative techniques to discover, develop, and bring to market those medicines and vaccines that will help you and me and all that we care about live longer, healthier lives. But we also know that innovation comes in different forms. And today, I want to talk about innovation at the individual level. Now, this audience is probably full of innovators. You know the type. They're the ones that see a problem and are already thinking about a solution. They move with urgency. They place bets and they take risks. And today, I'm going to tell you their story and the characteristics that have helped me change the way that I think about the work that we do. Respect for the communities that they serve, adaptability to their circumstances, and perseverance. Now, let's start with Ava. Ava is Regional Director of North Star Alliance. She embodies respect, and here's why. North Star Alliance is a partner of the Pfizer Foundation, and they provide HIV and AIDS services to individuals living in sub-Saharan Africa, with a particular focus on two high-risk populations, truck drivers and commercial sex workers. They place these blue shipping containers along transportation routes so that individuals can access healthcare services when and where they need them. And this is where Ava shines. Every person who walks through the door of a blue shipping container is treated with respect, with dignity, as a person worthy of receiving quality healthcare services. And what Ava reminds me is that when we think big about population-based health interventions, we need to step back, reflect, and make sure that we're respecting the individuals and the communities that we seek to serve. Next, Zubaida. Zubaida co-founded an organization called EYES, and the characteristic that she embodies for me is that of adaptability. Zubaida has a fascinating story, and some of you may know her story. She's an engineer by training, but in 2008, she was in India, and she met with a midwife, and she asked her a very simple question. Show me the tools that you use to deliver babies. And she was shown a sickle, which is a tool appropriate for farming, but certainly not for cutting an umbilical cord. She had an aha moment. Could she use her product development skills to create a solution for unsanitary birth conditions? Well, in fact, she did. This is the Clean Birthing Kit. It's available for less than $2, and it includes 6 simple tools and steps that a midwife can use to ensure a safe, sanitary birth environment. Now, we've been fortunate to partner with EYES through the Pfizer Foundation. And since that partnership started, they've distributed more than 18,000 kits and reached 35,000 moms and babies. Zubaida didn't graduate from engineering school thinking she would be a healthcare innovator, but she is. She adapted. She saw a local problem. She created a local solution. And she reminds me every day that we must adapt to the circumstances that are presented to us. Now, last, but certainly not least, Tshome. Tshome is Regional Director for the International Trachoma Initiative. And for you to understand the power of his perseverance, I have to tell you a little bit about trachoma. Trachoma is the leading cause of preventable blindness. It is spread by an infection. Pfizer happens to make an antibiotic called Zithromax, and some of you may have taken it, that treats that active infection. But we know that in order to eliminate a disease, and that is our goal, that it cannot just be the medicine, that it needs to be part of a comprehensive public health strategy. And so working with our partners and the World Health Organization, we have been advancing the SAFE strategy. Surgery for advanced cases of the disease, the distribution of our antibiotic that we donate to treat the active infection, education for young kids about how to wash their faces and hands, and of course, environmental development, access to clean water and latrines. And I'm proud to say that Pfizer's been a partner with the International Trachoma Initiative since 1998, and we now have more than 100 organizations and governments working toward the goal of global elimination. And more than 6 countries have already been certified as trachoma-free by the World Health Organization. Now, back to Tshome. Tshome has dedicated the better part of his life to this work. He literally goes house to house, community to community, to teach and educate people about how to prevent and treat this disease. He reminds us that we have to take the long view of innovation in global health, that sometimes the simple strategies are the best. His perseverance is one of the primary reasons why we've had so much success with this initiative. Now we have a great week ahead of us. I'm sure some of you are anxious to get on to your next event, but I hope that when you start your week, you'll actually reflect on these 3 individuals, on Ava, on Zubaida, and on Tshome. Because I know for those of us who work in global health, it's easy to get sidetracked about harnessing the power of innovation to change the world. The silver bullets, the gizmos, the gadgets. But at the end of the day, I think we all know the only way that we're going to achieve progress is through individual action, not just in global health, but to address the entire SDG agenda. And I believe if we nurture innovations and the qualities that support innovation, we've got our best chance at creating a healthier and more equitable world. Thank you very much.